Hello, my name is Ferdinand, and I'm the first downloaded today. Please, how may I help you?
Hi, I need a bottle of nasal decongestant for my blocked nose.
Okay, I'm sorry to hear about the trouble you're having with your nose due to your nasal congestion. Well, I would like to explain to you why your blocked nose is not getting better after your prolonged use of the nasal spray you are on. Well, it could be because you've used the medication more than you should have used it. And this is causing some vasodilation in your arteries that are located in your nose. So this makes the blood vessels to get widened and non-responsive to the medication you are using. Please, do you understand what I said?
Yes, I do, but it was very effective for me, but now it is no longer working.
Yes, it was effective before now, but at this present time, why it's not effective is because you've used it for a long period of time. So your body has got used to the nasal drop that at this point can no longer work. So I would like to let you know that you've got another alternative to the nasal drop we are using. So it's best we try another option, which is this nasal spray. So I don't know if you will give this a try.
I think um, I would have nasal decongestant because I don't want to try anything else. But can you explain how slime spray is better?
Well, at this point, saline spray is better because it will help your nose, the blood vessels in your nose to get rid of the habit of using the nasal spray. This time it will help to rebuild the weakened blood vessels in your nose, making it better for your nose to recover and then to be able to respond to any medication as it used to respond before. So at this time, it's better alternative compared to the usual nasal spray you've been using. So I don't know if you get my point.
Okay, I will try slime spray.
That's fine. Thank you. Okay. So do you know about saline spray at all? Do you know anything about it?
No, can you please guide me?
Okay. Saline spray it is a saline solution that comes in form of spray. So it's usually used as a substitute to normal to other nasal spray. So it will help you to rebuild your nasal blood vessels. Do you need more clarification on this, please?
What happen if it does not work? What should I do?
Well, if you try nasal saline spray and it doesn't work, of which I know it will work, but if it fails, you still have the chance of seeking for further solution. Maybe you can come back and then we'll discuss further on any additional medical needs if there be. So how does that feel?
Okay, thank you.
All right, so since we've agreed on giving nasal saline a try, so can I go ahead and now dispense your medication?
Yes, thank you.
You're welcome. All right, I'll go and get your medication ready. Thanks.
Okay, so the role play was exactly 5 minutes. That's a good time. Let's start from the start. Okay, so you were explaining this whole thing, but the patient only said that I have a broke nose, I need nasal decongestant. Patient is not asking you why the my nose is not getting better. Patient didn't say anything, so you cannot self explain things. You have to ask few questions, like you could be saying, first of all, the most important thing here, that your empathy at the start of the role play was not enough. It wasn't looking like that you were actually being empathetic. It was looking like, yeah, that you're only being formal and saying it formally, that I understand it must be troubleful. So it was not giving the sense of empathetic in your tones, so it wasn't building relationship at that point. And then you self-explained everything, so you could have been asked, saying the patient, oh, I understand, oh, you have this blocked nose, I understand totally that the blocked nose are very painful, like anything. So just be dramatic in your tone. Oh, I'm so sorry to hear about your condition. And then you can say, would you mind telling me how long have you been experiencing this thing, like they will tell you 2 weeks, 3 weeks, so you have to add for the other symptoms, when it started, you have to ask for the name of the patient, so you can do these things. So then patient might end up asking a question, like it was in my role play that I have to ask you, like uh, it gives me relief, then it is not working anymore, so I want you to explain me why it is not working anymore. So you have to wait a bit for patient to question something, and you have to ask in the start of the role play, do you have more symptoms, or when it started, and what's your name at the start. So that's how you will do your first start. And then you would ask this thing, nasal spine spray, like what the patient know about it afterwards. Like I have already asked you this thing, that can you tell me why nasal spray is a better option. I have already told you that thing, asked you that thing, and you have explained this part. So no need to ask this thing. Like it will only show that you were not listening to patient, because you have already explained me on my question, like why it is better. So no need to ask this. We are not you're not supposed to play this role play in reverse. You can only go forward. And then the last task was done better as well. So what can you do? First of all, the name of patient, then when it started, more symptoms, and then you can explain when patient will ask why it is not getting better. So you can tell that it is due to prolonged use, so now it is not working. Then you will try to convince the patient for using slime spray, because it is okay. Yeah, you will say that this nasal spray is not the best option. So you will tell the patient, and then you will tell the patient that it causes you rebound congestion. So then you will ask, do you can simply ask this question forwardly. So do you want me to suggest you any other option? So they will ask you any other option. So you can say, we have option of slime spray, do you know about it? Then the patient will be asking you, I don't know anything about it, can you tell me? Then you will tell them. So how you will do this? Yes, I would like to explain you the advantages of slime spray. Slime spray has many advantages over the nasal spray. Basically, slime spray is a substitute for the decongestant, because it will help your mucosa to recover, it will give it time, and it will also break the habit of using nasal decongestant. So how does these advantages sounds to you, like that? So these things should be done in a very good order. And one more thing, that you also taking very pauses, long pauses between the task, and your tone is not confident, like you are the pharmacist, responsible pharmacist of the pharmacy. So you have to speak like that, that you have authority and you are the in lead. So you have to be confident like a pharmacist. Okay. So this is the most important thing that should be in your tone, that the confidence. that you are leading as a healthcare professional, and you have to be empathetic towards patient as well, and you cannot take much pauses. It will also make you look like that you are not being confident. So do you have any questions from this role play?
No.
Okay, let's move to the next one. I actually have a blog note.